Hello, everyone. I'm Craig Bielik. I am with Ogden Regional Medical Center. We're going to take over the mic for just a few moments and talk about some of the things we have new at our hospital. Please continue to enjoy your lunch. We're very proud to sponsor this event. Always a good supporter of the Ogden Surgical Medical Association. What I'd like to do right now, though, is introduce you to our new Chief Operating Officer. He's going to just tell you a couple of things that we have new at Ogden Regional. This is our Chief Operating Officer. Excuse me. Please welcome Tracy Bertinoli.
This is a rowdy crowd today. I can feel it. I'm still a little bit wet from the rain. I most recently came from Eugene, Oregon, and if you want to know what it's like to live in Oregon, this is what it's like to live in Oregon for about 8 months of the year. So anyways, I'm glad we're getting the rain here, though. But as Craig mentioned, I'm the Chief Operating Officer at Ogden Regional Medical Center, and I just wanted to share a few things that we're doing at Ogden Regional to enhance patient care. So the first one is we're endeavoring down a more robust pediatrics service line development. So we belong to HCA, and HCA's brand name in this region is called Mountain Star. And through the Mountain Star brand across the Wasatch Front, we have started to develop hubs at certain hospitals to take care of inpatient pediatrics. And at one of them, we have a pediatric intensive care unit. The final hub to that is Ogden Regional Medical Center, which will be going live with pediatric hospitalists 24/7 in July. So currently, any non-select health insured patient goes down to Primary Children's for any basic acute care. What we would like to do is just invest into the community at the northern end of the Wasatch Front and bring in those 24/7 pediatric hospitalists. So the pediatricians can make sure patients are cared for and then they can stay local. So really excited about that. The second part of that is a pediatric multi-specialty clinic. And what we're doing there is partnering with local pediatric specialists to come into a clinic one day a week or once every couple weeks to see pediatric specialties. So currently we have a pediatric GI. We're looking at adding a pediatric cardiologist, pediatric endocrinology, and pediatric neurology. So that'll be a continuing effort, and those are pediatric specialists that work in the community, and they just want to partner, make sure that the patients here are taken care of. So, and again, we're really talking about non-select health patients. Obviously, Select Health has a good, robust pediatric network. And so we're really endeavoring after the non-select health patients that have to migrate down to Primary Children's. So those are kind of the two big as far as pediatrics. But filtering into that, one of the other things that we're really excited about is down in, or I should say up in Pleasant View. Some of you may know that we're building a freestanding emergency center. So this is at 2700 North in Pleasant View, and it's going to be a full-fledged emergency center. You'll have laboratory there on site. You'll have CT. We'll have board-certified physicians. It'll be open 24/7. And so we're really excited for that because the nearest emergency care is about 25 minutes away at either Ogden or McKay-D. And so as we've been talking to the community out in the northern area, they're really excited for that and to have that emergency care. The The thing with that is that there are going to be 12 total beds in that emergency center. There will be a trauma bed as well. So we'll be able to stabilize any patient that comes in with traumatic injuries, and then we will ship them to the appropriate level of care at the hospitals. The other thing I just briefly want to mention, another technology that we have just recently started, is a new robotic spine surgery technology called the Mazor X. And without getting too complex, I just basically, it uses imaging, and it basically allows the spine surgeon to place the hardware in the spine at more precise locations. I don't want you to get the idea that this robot is similar to like an XI or anything like that. It really is a navigation type of software. So that's been kicked off over the last couple weeks, and we're really excited for that type of thing. Finally, I want to mention one amazing technology that is really enhancing our quality of care. So we belong to a company called HCA, Hospital Corporation of America. And HCA, over the last few years, has developed a real-time tool driven by artificial intelligence. And what it does is it quickly identifies sepsis in patients. So the tool, which is called SPOT, that stands for Sepsis Prediction and Optimization of Therapy, it continually monitors things such as vital signs, lab results, nursing reports, and other data that's coming into the medical record. And it does this real time. And so what happens is using that artificial intelligence, that will notify the clinicians that something is off, and then they can make timelier decisions. And as you know, sepsis mortality increases quickly every hour that it goes untreated. So we're really excited about this technology that has recently come to Ogden Regional, and look forward to saving more lives with that. Having said that, I know we have a guest note speaker at 12:30, but if anybody has any questions, I'll be willing to take a few questions before my time is up. Don't everybody move at once. Okay. Well, let me just say this. Thank you for allowing Ogden Regional to be a part of your day and all that you're doing. I will say that I've come from two other medical communities, one in the San Joaquin Valley of California, and then another in Oregon, and this is the best. And the reason I say that is because I feel there's so much engagement, competencies, just a really highly educated community, and I can feel that here. So thank you for that, and thank you, and have a good rest of your lunch.